Hi there, this is Dr. Paul Chung. Some pediatric offices will offer prenatal consultation visits. And the main purpose of those visits is for expectant parents to get to know the pediatrician a little bit to make sure that they identify a pediatrician that they feel comfortable with. So I'm going to go over the usual things and topics that I go over during a typical prenatal consultation so that hopefully through this video, you can get to know how I practice and some of the logistics of our practice. As far as the background of my career goes, I initially out of pediatric residency was stationed in Korea. I was a pediatrician for the United States Army. And so I was stationed at a clinic for about an hour south of Seoul, Korea for 3 years. And then I was stationed at a larger Army hospital for 2 years subsequently. And during my 5 years as a pediatrician in the Army, the main types of medicine that I did was primary care pediatrics, covering the urgent care unit, doing consultations for the emergency room, and covering the newborn nursery. After I separated from the military, I moved to New York and I was a hospitalist for 8 years. And that means I was a pediatrician taking care of patients that needed to be admitted to the inpatient unit. So during those 8 years, I gained a lot of experience taking care of sicker children and a lot of children with chronic or complex underlying medical conditions. Then in 2018, I accepted a role as a site medical director and primary care pediatrician with Cornell at the Brooklyn Heights location because I wanted to be part of the new growing practice at that time, part of this community and this organization. And for me, it's been extremely fulfilling and rewarding, and that's briefly who I am. The reason I became a pediatrician, a couple of the reasons, is that I've always been good connecting with children. I've always enjoyed it, whether it was through different volunteer work at camps and activities during my middle school and high school days. And one of the things that I noticed would always put life into perspective, no matter how stressed out I was, whether I was studying for different licensing exams in medical school, would be things like me walking to the library to go study, and I would see a parent playing with their child on the playground. And that invariably, no matter how stressed out I might have been, always made me smile and laugh. So I thought that that would be a good environment for me to be around every day as part of my profession if it made me feel like that. And during my pediatric rotations during medical school, I found that I did well at different parts of that, having to focus on different physical exam skills and procedures and talking with parents and children, and I enjoyed it a lot. And I've been out of residency for approximately 20 years now, and I feel like I made the right decision. Even to this day, interacting with different ages of infants and children still never gets old and invariably makes me smile and laugh and enjoy my work on a regular basis. I'll try to describe some ways that I communicate to give an insight into some of my practice philosophies. There's going to be many decisions in pediatrics and a child's health where there won't always be a right or wrong answer, and a lot of the decisions involve pros and cons or benefits and risks of different interventions or evaluations. An example of this might be an ear infection in a 1-year-old child where a certain percentage of the time the child's immune system is going to fight it off on its own, and you do not need to initiate specific prescription antibiotic medications. There will be other situations that the symptoms might be more prolonged or pronounced, and there might be more benefits to starting the antibiotic medications. So in those types of situations, I'll do the best that I can to explain to parents in non-complicated language the evidence-based data that's out there and what are the pros and cons of different decisions and what might be the benefits of starting an intervention like a medication or what might be the potential side effects. Another example might be spitting up in a 1-month-old, which tends in general to be not that uncommon and relatively normal. And those symptoms can commonly be managed with behavioral and feeding modifications at home. It's rarer that there's more pronounced symptoms like poor weight gain or signs of significant heartburn or discomfort symptoms. And I will reserve bringing up and recommending medications for situations where the benefits would outweigh any chance of the rarer side effects. And again, I'll try to see if the parents have preferences as we discuss and make those decisions together. Because sometimes parents will have preferences. In certain situations, they want to be more conservative with interventions and try the home management options, and other situations where they might want to be a little bit more aggressive with interventions and start the medications at that time. And I'll take those preferences into account as we make those decisions together. If in a certain situation a parent says, we understand that there's these options, and you've explained the pros and cons to us, but we're still confused, you're the doctor, please decide for us. Then in that type of circumstance, I'd be happy to say that my preference would be this of the options and I recommend this path moving forward. And I tend to practice like that with medications in general, where I will tend to recommend them if the benefits are truly going to outweigh the potential risks, but I won't necessarily jump at medications at the very early first available opportunity. And I try to have that similar balance with other interventions like ordering x-rays or ultrasounds or lab testing or blood work. In children, it's not as common as adults that you need to order a lot of this kind of testing. And most of the time, the right decision in a child's health can be made with a thorough history on what symptoms are present or not, and a thorough physical exam. And it's not as common that we're going to be having to order a lot of testing. So I will recommend and employ testing when it's truly going to affect our decision making about the best way to move forward. But I'm in general not ordering a lot of tests commonly. And I try to achieve that similar balance with subspecialist referrals, where if they're milder symptoms, I'll try not to stress out parents by saying you have to see all these different subspecialists, but of course, recommending or employing them when their input is going to be very beneficial. And if in that type of situation, a family says, we understand that we don't have to see this endocrinologist or cardiologist or whatever specialist it might be, but it would give us peace of mind if we could talk to them. So when you put in the referral, then that's so non-invasive for the child and easy for us to do. Then in that type of circumstance, I'd be happy to provide that. During the periodic wellness checkups, which typically tend to be along the lines of every 2 weeks until 1 month old, every 2 months until 6 months old, and every 3 months until 18 months old, although we will adjust the schedule depending on the needs of the specific child. During those periodic wellness checkups, I will do my best to be thorough about going over the preventative and health maintenance topics that are the most important for that age of the child. So for the first few appointments, a lot of the discussion revolves around feeding and how to optimize the weight gain and strategies to increase the likelihood of successful long-term breastfeeding if the parents are desiring or committed to that. At 1 month old, I typically go over the timing of sleep training, why you would want to do that, and the different methods that are available. And at 4 months old, I typically go over the timing of when and how to introduce pureed solid foods. So those are some examples of topics that, of course, I'll make sure to go over during the periodic wellness checkups. And we're not just going to do an exam, detect abnormalities, and give vaccines during those checkups. As I discuss those important health maintenance topics, I tend to practice in a way that's thorough but flexible. So I try to provide as thorough of guidance as I can. But what I mean by flexible is that I'll say this is why sleep training is important, but there's many different methods of sleep training, different books that you can read. And if parents ask for a book, then of course can give a recommendation, but I won't say that you have to read this book or you have to use this specific sleep training method. With something like breastfeeding, there's potentially so many health benefits for the child. We will support that as much as possible. But if a family decides on their own for different personal reasons that they would like to do a certain amount of formula, then I will support them 100% in that decision and be careful to not use any language that might suggest any guilty feelings about that. So those are some examples of what I mean by I tend to be flexible in the way that I practice medicine. As far as vaccines go, we at our practice follow the usual schedule recommended by the American Academy of Pediatrics. So the first full set of vaccines at our practice will be at 2 months old. There is a vaccine that the nursery pediatricians will recommend in the first day of life, the first dose of hepatitis B vaccine. So we generally recommend complying with that recommendation in the nursery. And we recommend following the standard schedule, which includes rounds of vaccines at 2, 4, and 6 months old. And some of the reasons that I recommend following that schedule is that there are benefits to giving multiple vaccines at one time, given a more robust immune response. And if you split up those vaccines and don't give them at once, then the child just experiences multiple rounds of vaccine side effects instead of getting it done at one time. And there aren't any complications of giving those vaccines at one time. Most families will comply with this recommendation. If a family understands the recommendations but still requests to stagger the vaccines in a certain way, I don't recommend that, but I do tend to allow that on rare occasions. And I tend to allow that if specifically requested, although that comes up rarely. And our policy at our hospital and our practice is that we do not bar patients who are not fully immunized from entering our practices. So we cannot guarantee that every patient that is within the walls of our practice has every vaccine and is up to date on every vaccine, but most of them are, and we do not provide exemptions for vaccines unless the child specifically has a medical condition that is a contraindication for receiving a vaccine, but that is very rare. And additionally, we have protocols in our practice where we have workflows where if there's exam rooms available, then we'll have patients wait in the exam room until their appointment time is up to try to avoid having congestion in the waiting area. And there is a separate waiting area for newborns up to 2 months old and another larger area for non-newborn patients. As far as the logistics of our practice goes, each of the pediatricians are in the office 4 days per week, and 1 day is an administrative day where the pediatrician works from home. And in general, we're in the office around 9 to 5. Our office will open most days at 8 and close at 6 because the pediatrician takes turns starting a little bit earlier and later, but in general, each pediatrician is in the office 9 to 5. About 80% of our visits are reserved for the wellness checkups that I mentioned earlier, and 20% of each pediatrician's daily schedule is reserved for newborn visits in the morning and same-day sick visits scattered throughout the day. So that if something urgent comes up with your child overnight or in the morning, then it's more likely that you'll be able to see your pediatrician. It won't work out perfectly like that every day if those appointments were taken by other families earlier in the morning. And in those situations, the call center, or if you go on to your Connect account, you would be offered one of the other pediatricians as long as they have some open slots. And in those situations, we cover for each other and communicate as much as we need to about each other's patients. But in general, we try to support as much as possible your child seeing your primary care pediatrician for most of the visits. Our Brooklyn practice is not open on Saturday and Sunday, but there are 3 other Cornell pediatric sites open in the mornings on Saturday and Sunday. And the closest location for our patients is the Tribeca location on Saturday and the downtown William Street location on Sunday. So there are morning appointments available for urgent needs if they come up. And at nighttime, after our call center closes, or later in the afternoon on Saturday and Sunday, something urgent comes up and you need to talk to somebody, then if you call our appointment line, there will be a phone tree option where you will be connected to a pediatric emergency room nurse who we contract out of a different organization. And those pediatric emergency room nurses are excellent at providing guidance on urgent issues as they come up. If something comes up during regular office hours, like a weekday at 10 a.m., and you're not sure if that issue with your child is serious enough that you need to bring them in, what you would like to talk through it, then the best way to do that is to schedule a video visit. We have video visits available for multiple hours every day, including in the mornings on Saturday and Sunday. And that is the most thorough way to get guidance about the issue, because we can talk back and forth about what symptoms are present or not, and we can visually see how your child is appearing. And that is much more reliable than trying to talk through new symptoms back and forth over messaging. You definitely have the capability to call us and leave a message or send messages through the patient portal for simpler questions. Those messages will always go to either our medical assistant or our pediatric triage nurse first. And our triage nurse is also very skilled at giving guidance about general pediatric issues. She will forward that message to us if it needs our input, and we're doing our best to get to those messages in between patients at the end of the day or in subsequent days. If you decide to follow with me as your primary care pediatrician, the process is not complicated. Just take our scheduling phone number with you when you go to deliver, which I'll make sure to include in the description of this video. Take our scheduling phone number with you when you go to deliver. If everything goes smoothly, then you'll be discharged home with your newborn approximately 48 hours after delivery. And at that time, the newborn pediatricians will give you some guidance on when the first newborn visit should be, which is going to be within 1 to 3 days after discharge. So once they give you that guidance, then you would call us at that time. I'm being discharged later today with my newborn. I want to make a newborn visit with Dr. Chung tomorrow or day after tomorrow, or whatever timeline that they had recommended. And our agents will take some demographic info and schedule you an appointment at that time. There isn't any other type of specific pre-registration or reservation process. I don't have a long list of things that I tell parents to purchase before delivery. One of the things I do recommend ordering and having on hand is an electronic breast pump to have on hand at home when you come home from the nursery. Not every mother will need to use a breast pump if the breastfeeding is going very well, but in certain situations, it sometimes can be helpful for stimulating milk production if for the first couple days the infant is more sleepy or not as vigorous with feeding as they will be in subsequent days. So that's one thing that I do recommend ordering and having on home beforehand. If you need a book recommendation, then a good book is called Your Baby's First Year, and I'll make sure to include a reference for that down below. And a good website for pediatric issues as they come up is healthychildren.org, which is from the American Academy of Pediatrics. Those are the usual topics I like to go over during prenatal consultations. Hopefully that gave you a general idea of how I communicate and practice. I hope for everyone listening that everything goes smoothly until delivery, and you can reach out to us with any needs. Bye now.